Good morning, everyone. Welcome to the Acute Care Transition Program webinar, also known as ACT. We are delighted to have you join us today. We ask that you please mute your microphone and stay on video during the presentation. Also, please note the webinar will be recorded. We ask that you hold your questions until the end. We will have a Q&A session following the program presentation, and at that time, you can unmute yourself and ask any remaining questions you may have. Our objective for today's webinar will be to provide you with information about the ACT program. We will review the cohort timelines, hiring units, and the ACT program curriculum. We will also present information on the application process and expectations of prospective applicants. I would like to begin today by introducing myself and my fellow panelists. My name is Serena Yazdani, and I'm a nursing professional development specialist at Stanford Center for Education and Professional Development, and the co-lead for the ACT program. I'm joined today by my nursing professional development specialist partner and ACT co-lead, Liza Garcia. And we are delighted to have our partner, Carly Dye, joining us. She is a senior talent strategist here at Stanford Healthcare. So who are we? Stanford Healthcare is a home for passionate achievers. We are a large academic medical center with more than 300 facilities throughout the Bay Area. We are the only level 1 trauma center between San Francisco and San Jose. We have 15,000 employees at Stanford Healthcare, and 3,500 of those employees are clinical nurses. Our Palo Alto campus has over 600 licensed beds, 100 licensed ICU beds, and 53 operating rooms. There are more than 450 life flight transports annually, and we see approximately 70,000 adult emergency room visits per year and over 2 million outpatient visits per year. Across every discipline and at every level, our people have advanced medicine in ways few thought were possible. In our more than 160-year history, we have seen so many firsts. We will continue in our relentless pursuit of excellence, creating life-changing achievements for people all over the world. Together, we deliver life-giving hope as we continue to move Stanford Healthcare forward, one breakthrough at a time. It's a journey worth celebrating, and one we would like to invite you to share with us. Now that you know a little bit more about Stanford Healthcare, let's start learning about the ACT program, the Acute Care Transition Program. Our program is thoughtfully designed for highly motivated, determined, and compassionate nurses. The overarching goal is to develop competent, compassionate, and committed clinical nurses in an acute care setting who make a positive impact in the lives of our patients. We'd like to share some brief information about our first ACT cohort, which started on February 6, 2023. Out of 54 applicants, we hired incredible, enthusiastic individuals into our first cohort. And these individuals came from a wide variety of previous work experiences. We had representation from long-term acute care, skilled nursing, and several specialty outpatient clinics. Our first cohort is all currently working on our inpatient medicine units, and we are so lucky to have had the opportunity to support them through the ACT program while they begin their career in acute care nursing at Stanford Healthcare. At this time, I'd like to give the floor to my colleague and program co-lead, Liza Garcia, to explain the program curriculum.
Thank you, Serena. So part of how we meet our goal to develop competent, compassionate, and committed clinical nurses is through our curriculum. The ACT program curriculum is partially adapted from our Vizient Nurse Residency program. Our program isn't an extension of nursing school, meaning we don't reteach foundational nursing concepts. Instead, we take all of your background knowledge, skills, and experiences you have and build upon them and teach you how to apply all of that in an acute care setting. The program integrates 3 principal domains: leadership, patient outcomes, and professional role. When we look at leadership, we are looking at how to develop decision-making skills, how to communicate effectively in a professional environment, how to coordinate care of various patients, how to use resources, how to escalate, how to delegate, all of those skills that create a good leader in the clinical environment. We show you how to use the experiences you have had and incorporate it in the clinical setting. For the domain of patient outcomes, we look into the management of patients who may be deteriorating, what we do, and what resources we have. We look at how to integrate patients and families when providing patient education to achieve beneficial outcomes. We overview how to take care of a patient in pain and meet their needs. We also look into critical thinking of infection prevention and sepsis management. When we look at professional role, we really emphasize and put a lot of thought into how we can help our nurses manage stress and engage in self-care as they transition into this new role. Just like how we view the care of patients to be individualized, we recognize that everyone perceives stress and self-care differently, so our program helps provide the tools to be able to care for yourselves. Towards the end of the program, we look at professional development and what the future holds for you and provide resources so that you can achieve your aspirational professional goals. Let's go over how we do all of this within our program. Our program is a 6-month program that is structured by 3 categories: clinical orientation, program seminars and simulation, and collaborative check-ins. This is what drives our program, so we'll take a little bit of a closer look into each section. Our first category is orientation. Our participants engage in an orientation process that has over 192 clinical hours with a trained preceptor. We like to throw the word trained there because our preceptors do volunteer to precept and go through training prior. Some of that training includes how to give feedback, understand different learning styles, how to teach to those learning styles, and help the preceptor understand the process of guiding a nurse from an advanced beginner to a competent nurse. Our orientation follows the TSAM precepting model, which we will discuss shortly. By utilizing TSAM precepting model, the length of orientation is personalized, and it depends on the individuals demonstrating competency through the skills. The goal is for each new hire to have a safe transition to independent practice. Our second category includes seminars and simulation. We have classes and simulation facilitated by nursing professional development specialists and our professional practice partners. Again, not to reteach nursing school concepts, but to support your development and teach you how to apply the knowledge and skills you have to the bedside in an effective manner. We support your clinical development through both didactic and simulation-based seminars. We will look more into the content itself a little bit further into this presentation. Our third category includes check-in meetings. We follow the ACT participants with supportive and collaborative structured check-in meetings. A member of the NPDS team will collaborate with your unit leadership to follow your progress through the program, to offer support when and where it is needed. In the check-ins, we celebrate all successes, we identify any challenges and goals you are working through, and create action plans to help you achieve your goals. We have check-ins both during your precepted orientation and continue to follow you throughout the 6 months during your independent practice. Here is a brief overview of the content that we address over seminar. Specific areas that we would like to highlight are the focus topics of time management, prioritization, and organization, how to navigate through your resources, self-care and caring science, emergency response simulation, critical reasoning within the care and coordination of a high acuity patient, and professional development. During your first onboarding week, you will attend a full day of EPIC training. EPIC is our electronic health record system, so this class will guide you through electronic charting and medication administration. We also offer a basic EKG course. We understand that many of our candidates are coming in without a lot of telemetry experience, so we offer an EKG course that covers basic interpretation and dysrhythmia management to help you care for cardiac monitor patients. We recruit talented and accomplished nurses, and we want to provide you with opportunities to grow within our organization. Stanford is committed to growing and developing clinical nurses from the moment they enter the ACT program and throughout their prosperous careers. We offer resources that provide you with the tools to achieve your aspirations and all of your professional goals. Some of those include career advancement, specialty certification, clinical ladder promotion, educational opportunities, and organization-wide committees, amongst many others. Now that you know a little bit more about the program, Serena will provide details about the application process.
Thank you, Liza. So here's an overview of our ACT program 2023 timeline. We will be hosting 3 cohorts a year. Our first cohort this year was in February. And for today's webinar, we will mostly be discussing our upcoming cohort, which is beginning June 5th, 2023. But just to keep you in the know, we're also going to be having a 3rd cohort starting November 6th of this year. Let's review the hiring departments for our cohort 2 that's beginning in June. We have 3 hiring departments: B2, Medicine AAU, G1, Surgical AAU, and 500P ACA, that stands for Alternate Care Area, and that's AAU overflow. So you might be wondering, what is AAU? AAU stands for Acuity Adaptable Unit. An AAU is a treatment model in which a patient receives care according to their medical need without having to transfer units. This means any patient who needs medical care, ranging from acute care all the way up to intermediate intensive care, can be cared for on the same unit. Nursing assignments can be adjusted frequently throughout the shift based on the acuity of patients there. In other words, the unit adapts to the acuity of the patient without our patient needing to transfer. By minimizing the number of times a patient transfers, we can help decrease medication errors, infection rates, and medical complications. So here's a brief overview of the 3 units that are hiring. B2 is a 27-bed AAU medicine unit. Patients typically seen on this unit are telemetry, cardiology, transplant, hemodialysis, and kidney failure. G1 is our 27-bed surgical unit, specializing in gynecology and gynecology oncology. And 500P Alternate Care, ACA, is a 34-bed unit. This unit consists of post-surgical and medicine patients, and their patient population includes urology, neurosurgery, general surgery, and general medicine overflow. Before you is a timeline of the dates for our June 5th ACT cohort. So we recommend taking a screenshot or a picture of this slide so that you'll have the dates and the job title and requisition handy. So our application for the ACT program opened today. and it's going to be open until April 7th. And that application is posted on our Stanford Career website. There will also be one job posting to apply for all positions in the program. So we did put the requisition for you here on the slide. It's R2327633. And so that's one requisition that you apply to for all positions. After April 7th, hiring managers will be able to look through applications and they'll host unit level interviews within the 2-week period from April 10th to April 21st. Final offers will be made to selected candidates from April 21st to 26th. And from that time, our Human Resources Department will partner with you to process your employment in time for your start date of June 5th. Here is an overview outline of the application requirements for the ACT program. You must have an active California registered nurse license. You need a minimum of 12 months full-time experience as a registered nurse in any non-acute care setting. There is a requirement for certifications from the American Heart Association. You need 2 of them: Advanced Cardiac Life Support, also known as ACLS, and Basic Life Support, BLS. You also need to complete all required application documentation, and that is an online application. So the required application documentation in total will be a cover letter, a resume, and completion of the electronic application on the Stanford Healthcare Career website.
So let's talk about those requirements, beginning with a cover letter. A cover letter gives insight to your soft skills, attitudes, and motivation. It introduces you to an employer through a personalized explanation of your qualifications and interest in a position. Employers use cover letters to get a sense of who you are and how you would use your experience to accomplish the requirements of a position. Here are just a few suggestions of what you may choose to share in your cover letter. Why nursing? What motivated you to choose this career? What have you done or overcome to get to this point in your nursing career? What makes you uniquely qualified for this role? This is a summary of all of your experiences thus far. Why Stanford? What are you looking for in an organization? And what can you offer the organization? How are your values aligned? What do you plan to accomplish in your future? While your resume may speak of your past experiences, your cover letter can summarize your future goals. The main purpose of this cover letter is to support the content of your resume. Your resume focuses on your qualifications and achievements, and your cover letter expands on those achievements, showcasing your personality and explaining why you would be a good fit for Stanford. Your resume will share all of the technical details of your skills and work experiences. It provides a summary of your experience, your abilities, your skills, strengths, and accomplishments. It states relevant information regarding your education, experiences, and job-related interests. It demonstrates what you have done in the past and how that aligns with the qualifications of this job that you are seeking. Your resume is your personal marketing tool and allows you to effectively and clearly communicate your assets to a potential employer. Note that all of your work experience does not have to be healthcare related. You could have been a management position, a car salesman, a barista, food services. All of those positions can demonstrate skills and experiences that you can use in your career as a nurse. So think of your resume as an advertisement. It advertises you, your unique skills, your qualifications, and highlights all the benefits that you have to offer. Here is a snapshot of the electronic application you will complete and all of the information you will need to provide. A lot of this will be familiar as a standard employment application, but the section we do want to highlight on this slide is the questions you will be asked to complete. You will be asked, why are you interested in Stanford Healthcare? How many years of work experience do you possess as an RN in the United States? You would ask to describe the overall experience as it relates to your position. And what is your personal definition of nursing excellence, and how is that reflected in your daily practice?
Once your application is submitted, a manager will review your application. If you are selected, a manager will reach out to you for an interview. So what can you expect for that interview? Well, a portion of your interview will be behavioral style interview questions. And so with these questions, we want you to focus on your past experiences and provide specific examples of how you've demonstrated certain behaviors, knowledge, skills, and abilities. Think about your nursing experiences, teamwork, prioritization, communication. We'd like you to tell us what you did rather than what you would do. Understanding how you responded to specific situations in the past serves as the best predictor of how you'll respond going forward given a similar situation. When you're answering a behavioral style question, we'd like you to consider the following 3 elements. Situation. It's your story. What happened? Actions. What was your response? What did you do? Who else was involved? And the outcome. What was the result? What changed because of what you did? Tell us your story. So on the screen before you, you'll see a few examples of some behavioral style interview questions that you could be asked. So tell us about a time during your work experience where you needed to escalate care quickly and efficiently. What was the situation? What action did you take to escalate this care? And what was the outcome? So when we look at a question like this, I'd like you to think about examples from your nursing career where maybe in this specific example, we're looking for escalation, we're looking for communication, delegation, resource utilization. So think about those elements and how your example can really put those things forward. Our second example interview question, tell us about a time when your patient's plan of care suddenly changed. What was the situation? How did you respond to the change? And what was the outcome? So for this question, it would be good to highlight prioritization, delegation, resource utilization, and escalation. And last, describe a time when a patient, a family member, or a colleague's view was different than your own. What did you do to understand the other person's point of view? Did you try to reach an agreement? What was your approach? And what was the outcome? So think about all the elements the question is asking for and how you'll communicate each quality through your response. This question, it would be great to bring up the elements of cultural competency, diversity, communication, and relationship building. So now that we've talked a little bit about behavioral style interview questions, we also want to provide you with some tips for your interview preparation, practice, and performance. So to prepare, we recommend brainstorming. Brainstorming is an activity that you can do with yourself. Ask yourself, what values and qualities of a clinical nurse do you possess? Think about when you've performed a memorable experience in your career around teamwork, communication, or even giving difficult feedback. Choose an experience or scenario that you feel comfortable sharing. Speak to a story that you are the center of. We want to know what you did and what role you played. How have you demonstrated these qualities and what sets you apart from everyone else? So that's the preparation element. And then we need to practice. So we want to review these stories so that we feel comfortable sharing our experiences. It can be very helpful to speak in front of a mirror or record yourself or even practice with a friend or a family member. Speak out loud. It really helps to hear yourself and where you need to make corrections and what elements of your conversation and your presentation are working. Conduct a random interview. Get used to the unexpected. The more you practice, the more comfortable you will feel when you sit down for your interview, and the more you are able to let your true self shine. For performance, on the day of your interview, position yourself in a quiet, comfortable space and limit all distractions if you're able to. Ensure that your device is fully charged. Wear professional attire. Listen carefully to each question. And remember, you can ask for a question to be repeated if you were not sure or you needed a moment to compose your thoughts. If you're feeling nervous, remember this is simply a conversation to get to know you better. So take a deep breath and show them your personality.
Here are some important application reminders. So first, you want to make sure that you turn in a cover letter, a resume, and you complete your electronic application. You want to apply only one time, and if you're concerned that an error occurred, you can email talent@stanfordhealthcare.org to describe the error. Be mindful that the application window, please do not wait to apply until the last minute. Late applications will not be accepted. And please use only one identifier that remains consistent on all of your documentation. So your cover letter, your resume, and your application information. For example, if your documents have your middle name, please also include your middle name in your application. At this time, I would like to introduce Carly, our HR partner, who will discuss salary and benefits.
Hi, everyone. Thanks for joining us today. I will be talking kind of about the HR side of the onboarding process. So when you get hired here, your rate of pay is based on years of experience. Obviously, everyone applying for this role is coming with non-acute care experience. So yes, we count that experience. So it's how many years of paid RN experience that you have. So your starting rate of pay can range anywhere from $80 an hour to $93.21 an hour. That is your base rate. There are different shift differentials, 10% for evening, 18% for night shift, and 5% for weekend shift. For anyone that lives 120 miles outside of Palo Alto, we do offer a $5,000 relocation sign-on bonus that will be paid out on your second paycheck. We also have a couple of different partnerships with various apartments around the Stanford community that give short-term rental leases, discounts to Stanford employees, and so forth. We also have transportation discounts for all of our employees. For PTO, because I know that's always a huge one for everyone, you get 36 days each year, and that includes holidays. It increases to 39 days once you've been with us for 10 years. We offer a full comprehensive benefits package. There's medical, dental, vision. Everything is effective the first day of the month following your orientation. So for anyone starting with our June 5th cohort, you would have your benefits elected on July 1st. We have 3 different medical plans, one being an employer paid plan. We also offer tuition reimbursement up to $2,000 per year, or you can use that to make payments towards your student loans. And then just a couple of announcements that we always like to make sure everyone is aware of. At Stanford Healthcare, because of Santa Clara County requirements, all of our employees are required to be vaccinated and boosted and able to show proof of vaccination for COVID-19. And for all of our clinical nurse 2 positions, it is a union-based position. You will be overseen by Corona Union, who oversees all of the nursing at Stanford Healthcare, and Lucille Packard as well.
Thank you, Carly. At this time, we will also answer a few frequently asked questions. So for cover letter, how long should a cover letter be? Cover letters can be anywhere from 1 to 2 pages, however long you feel it is that you will need to meet your goal of what you want to be included. It can be formatted under Word document or PDF or however, whatever is easiest for you. Who should I address the cover letter to? You can address it to whom it may concern or Stanford Healthcare's Acute Care Transition Program. Does Stanford use a software application to scan for keywords? We do not. Each cover letter is read by one of our colleagues from our departments. For resumes, some frequently asked questions are, how long should a resume be? Again, similar to your cover letter, however long you need it to be to cover the information that you would like to share. It can also be formatted by Word, PDF, or whatever is easiest for you. Should I list any non-healthcare related work? Most definitely. Any job or experience makes you uniquely you, and all of those skills in your previous experiences can help you as a nurse. Is all volunteer work accepted? Yes, but especially those that are more recent. Should I provide my RN license, and should I provide my BLS and ACLS? Yes, you should include all of this licensing information as it is part of a minimum job requirement to have prior to starting. And can I list any other elements such as skills, certifications, accomplishments? Definitely. Anything that you would like your potential employer to know about you.
So I'm going to cover some frequently asked questions about the general application and program. Can I choose which unit I want to work on? Well, there is no place on the application to designate unit preference. However, you may choose what unit you would like to interview with should you be invited for multiple interviews. What's the interview process like? As we discussed earlier, it will be a behavioral style interview. So give some thought to the tips we provided earlier and prepare some, rehearse and answer some scenarios that you can use for those. How many people are you hiring? We have 3 units that are hiring with the ACT program for our June cohort. Each unit will determine how many candidates will receive an offer. If I have applied before, but was not selected, can I apply again? Yes, absolutely. If Stanford is your aspirational goal, we highly encourage you to apply again. What if multiple managers contact me for an interview? Wonderful. You have the choice to interview with all units if you would like. What if I have a planned vacation during the program? Well, all seminar dates will be shared with you prior to starting. The seminars are a requirement to be a participant of the program. Clinical unit orientation is arranged by the managers, and you could discuss with them if there's any flexibility around those dates that you need off. So we do hope that these questions and answers, these frequently asked questions and answers were helpful for you. At this time, we'd like to open the floor for you to unmute yourself and ask any questions that you still might have. And I'll look at the chat as well, and we'll see if any questions are coming through there, but please feel free to unmute your mic and ask any questions that you might have. We are here to answer.
I have a question.
Yes.
My question is, do you guys have like a time frame as how long you've been in RN? For example, I graduated in summer of 2020 during the lockdown, and our paperwork was, all the paperwork was like pretty much frozen during the pandemic. So we couldn't go and get our NCLEX exam until all the process went through. And so that kind of delayed everything for us. So I've been stuck trying to apply for new grad programs since summer of 2020. But I did transition from an RN to BSN Bridge program, and I graduated from that May 2022. Will I be considered still a new grad? And if so, is it counted from 2020 or 2022?
So for our program purposes, we ask for 1 year of nursing experience prior to application to our program. This program is designed for nurses that are looking to transition that do not have acute care experience, so that piece is okay. But we do need a year of RN experience working.
So for example, like I worked in a COVID project where we tested for COVID and vaccinated for COVID. Will that be considered a year of RN experience?
If you worked in a COVID clinic or any specialty clinic for 1 year prior to application to our program, yes.
Okay, so there's no window, I know few new grad programs, they want it up to a year since you graduated from your RN program, or within a certain amount of months. But do you guys don't have that limitation?
No, we do not.
Okay, thank you.
Thank you.
We'll pause here, guys. You have lots of questions. Hi, everybody. My name is Denise Shaw. I'm a director here at the Center for Education. So I'm going to circle back to what they said earlier and just now. 1 year working experience. So whenever you got your license, it means date of employment. So that means years of experience. Remember, this is a transition care program. So clinic experience, COVID clinic. The purpose of this is to get you ready for acute care. So what happens is when you apply here, when the managers hire you, some may be a panel, some may be just the manager, where that will be worked out. When you are selected for a certain unit. So if you get hired into G1, then you are hired into G1. 6 months is when your probationary experience is completed. Okay. So questions about whether you need to be in the US or non-US, I'm going to have Carly answer those questions. However, there's a question about how is your experience proven? Well, we do a background check and all of those things. So yes, Carly's answering the ACLS question. As long as it's renewed by the time you start. How many applicants will be hired? We're still trying to figure that out. We had a small cohort for the first one, which was only 5 people, although we were open to hire 10. So any other questions? So I'm going to pause there because I think I answered everything that was in the chat. And Carly, about the US, do I not qualify if I have more than 1 year experience? So remember, 1 year from the time you are working. So if you're working February 2021, 1 year of employment would be February 2022. So 1 year of working experience. So you guys can calculate what that means.
Hi, I have a question.
Yes.
Yeah, currently I don't have my ACLS, and I believe that the last day of sending an application is on April 7th. And I'm not sure if there are still some institutions that offer some ACLS course. Would I be still considered for this application, and I am willing to do the ACLS training once it's available.
Yes, for your ACLS, technically you just need it 1 week prior to starting. So with the cohort starting June 5th, you need to have it for our TA onboarding team to be able to verify that you have it by May 30th. So you don't have to have it by the time the application closes. You just have to have it by the time we need to clear you to start with us. So you have all of April and most of May to get that completed.
Oh, okay, that's great. Thank you.
So sign up now.
Yeah, thank you.
For Justina's question, can I list all the certifications that I have? And do I put cert numbers, expiration dates on the resume, or do I send the certifications themselves? You definitely on your resume list all the certifications that you have. And then if we need the expiration dates or for proof of certification, we will reach out to you.
I have a question.
Yes.
For the interview process, if we, so say we worked in healthcare before we were nurses, like as a CNA or medical assistant, are we able to draw on those situations in like the situation-based questions, or do you want it mainly from our nursing experience?
Absolutely, you can use that experience, and anything that you feel in your background, you could even use non-healthcare experience, but nursing and healthcare experience, I think, can really be helpful through the hiring process to kind of show who you are. But yes, absolutely use that experience for your behavioral questions. Yes, great question.
Thank you.
Does working as an RN aesthetics count towards the year of experience as well? Yes, it does.
Hello, I have question.
Yes.
I graduated outside of USA, and I just had license here last year. And all of my experience is from my country. Do I still qualify for this program?
Yes, you will still qualify for this program. It's just the only minimum requirement is just at least 1 year full-time RN experience, but it can be outside of the US.
Thank you so much.
Mm-hmm. Any other questions?
Liza, there's a question about clinical training. So we want to, I'll have you repeat what the clinical training is for each unit.
Yes, hi, Chad. Let me go ahead and just show you back this page. And again, this webinar was recorded. So if there's any information that you may have missed, it will be in on the Acute Care website. So how long is the clinical training for each unit? So we do utilize a TSAM precepting model where the training is individualized. The length of orientation is personalized and individualized based on your own ability to demonstrate competency through the skills. So we offer at least 192 clinical hours with your trained preceptor, but in the event that you might need some extra support, that is the length of time will be dependent on your own practice. If we are a year experienced by the start date, can we still apply or be considered? Yes. If you have a year experience by June 6th, you can still apply.
Hello, this is Lily. Can you hear me?
We
Yes,
can.
Lily.
Oh, perfect. I have a question. If I'm a labor and delivery postpartum nurse with more than 1 year of RN inpatient experience, do I qualify to apply?
More than 1 year? Yes, please apply.
Okay, even if I am inpatient currently and looking to change unit, I do qualify to apply?
You can actually apply as an experienced RN. I know labor and delivery is different. You have acute care experience. So Carly, where are L&D nurses applying to? I see those applications go straight to the unit as an experienced nurse.
You can, however, a lot of our units aren't accepting L&D nurses because they really want strong telemetry background. And they feel that L&D nurses do not have that. So this would be a great stepping stone to gaining that experience and then down the road transferring over to another unit.
Okay, great. Thank you. Yeah, I know it's a very different patient population, so I just wanted to confirm I can apply. All right, thank you so much.
There's a question about training being paid training. So anytime you're here and you're working, you're always being paid. I hope I answered that question about training. So when you're working, you get paid. And then I'm sorry, I don't know your first name. Your hand is raised. We see your email address. Go ahead and answer your question.
Hi, my name is Brenda. I do have a question, but Lily answered that my first question. I just wanted to know if it's minimum 1 year experience as an RN, but then more experience is okay if it goes over maybe like 2 months.
Oh yeah, the goal of this program is to provide extra skills or extra didactic because you're not used to the acute care setting. So you can be a SNF nurse. I mean, we anticipate like if you're a SNF nurse for 8 years, right? The whole point is it doesn't have to be just 1 year. It's you don't have any experience in the critical care arena. I mean, in the acute care arena, and that's what we want to provide.
Perfect. Thank you. That makes perfect sense. And then my other question is, I think at the beginning of the presentation, I saw 54 applicants. Is that the number of people who were hired or more applicants to get to stay?
54 applicants who applied. So the candidates that were in the actual program, we allocated for 10. It was much less for other reasons, but it's 54 who applied.
Okay. Thank you.
Justina?
I have a question. So if I am fully vaccinated, but I am not boosted yet, should I apply? Or should I first get boosted and then apply?
You are welcome to apply. As part of your onboarding physical, if you aren't boosted, we offer that when you're there getting your physical done. So don't let that hold you back. We don't ask your vaccination status on the application. So that's only something that you need to worry about. If you get offered, then you have to meet that deadline. But again, we offer all of that at our on-site physicals before you get started.
Got it. Thank you so much.
We have a question, is RN supervisor role in a skilled facility still qualified since it's a supervisor role? Yes, that will qualify as long as you're utilizing your RN license. And when is cohort 3 starting? Cohort 3 will be starting in November 6th. Is there any more questions we have? Do you accept applications on TN visa?
As far as visas, we accept applicants that need sponsorship. However, just due to a lot of delays right now, we can't guarantee that your application will be processed and approved prior to the start date. And for this program, you have to start on June 5th. You're not able to push your start date back.
Hi, not a question, but I'm so excited, Justina. We are too. We're excited. Please apply. Will training be at daytime hours? Will it be during the daytime hours? Yes, the seminars will be daytime hours. The positions on the unit may be rotating, which may mean that your precepted time would either be night shift or day shift, and that will be dependent on the unit. But the seminar dates will be daytime. And the next question is, when will the application process for cohort number 3 start? We are still finalizing.
Carly, would you be able to pull up the dates for that?
Yes, I'm looking at the note. So for that one, applications would be opening the middle of September. And so it'll be posted on our career site. And then on the acute care, I will put in the chat the landing page for the Acute Care Transition Program. That will always have the updates for, right now it'll have the timeline for the current cohort, but as soon as that one starts, it'll have the dates for the next one. It'll have this webinar saved to it. When we do the next acute care transition webinar, prior to applications opening in September, we'll have information on how to RSVP for that one as well. So all of the info can be found on that one page. So it's a great resource to bookmark and just check periodically for updates.
Thank you. Natasha has a question. So to clarify, if we have 1 year of acute care experience, it is not recommended to apply to this program. I relocated back to the Bay Area. I wasn't sure what the answer was to someone who had asked about switching units. So I guess to answer your question, we just need a little bit more detail when your last year of acute care experience was. If it's recent, this program might not necessarily cater to the needs that you will have as you have recent acute care experience. However, if you've been on an extended long-term gap since your last acute care experience, like I would say at least over a year, then you can apply. But if it's a recent experience of 1 year acute care, this program might not be the most suited to what you will need. Is there going to be another Zoom meeting prior to starting cohort 3? Yeah, we will likely be hosting another webinar. Judy's iPhone, Judy, sorry. When will the application start? So Carly did say to just keep an eye out on the website for our November cohort for all the dates that you will need. This recording will be ready after 24 hours and it can be accessed on the website. If you get accepted for cohort 2, but later one you are not able to accept it, can you be accepted into cohort 3 or would you need to reapply again? You will likely need to reapply again. How long are shifts on these units or do they vary? For Stanford Healthcare, for those 3 units, your shifts will be 12 hours.
Right, so let's pause for a hand raise. Mayra, you have a question?
Yes, that link that you just sent on the chat, is that the only place where we apply? Carly Day
Yes.
sent a link. That's the only one we applied to.
Yes, there's just one application.
Okay, all right. And just to double check, if I have a year and a half of experience in ambulatory or clinic, it's okay, correct?
Correct.
Yes.
Yeah,
Thank you
so
so much.
again, guys, 1 year experience or more in anything other than acute care. So 1 year to however many years is fine. So date that back.
Any other last minute questions? Feel free to unmute yourself.
Hi, I just want to ask one more question. Like my experience outside of USA, I had ICU experience for 4 years, and I don't have any experience in USA. Do I still qualify for this program?
Is it recent experience?
I mean, I have ICU experience from my country for 4 years.
Is it recent or did you?
No, it's like last 5 years ago. I don't have any experience from.
Okay, then yes, you would qualify.
Thank you so much.
Hi there. Uh, can you hear me? Sorry.
Yes, we can.
I also just moved here from the Philippines last year, and I got my license by endorsement this year, last February, and all of my experiences in the Philippines, but it's just a small community hospital. It has like a 78 bed capacity, and I was like there for about 9 years. Am I going to be qualified for this?
Yes, you will be qualified for this
Yes,
position.
sir. Thank you so much.
Okay. If there are no further questions,
We just want to thank you all. Thank you everyone for joining our webinar for the Acute Care Transition Program. We appreciate your time and your interest. If you would like to review this webinar, it will be posted online. And we do hope to see you in our upcoming cohort. We would love to have you join our Stanford Healthcare team. Should you have any further questions, please email talent@stanfordhealthcare.org. Thank you, everyone.
thank you.
Thank you.